Hi, I'm Dr. Steve Grcevich. I'm the president and founder of Key Ministry. And today we're specifically going to look at how we implement the inclusion strategies we've discussed earlier to make it easier for individuals and families impacted by anxiety to be part of church. And in taking a look at this, we're going to go through and talk briefly about how you might want to think about your church's entire assimilation process and how the ways that you welcome visitors might create unintentional barriers, for children, adults who are struggling with anxiety. We'll talk a little bit about using a mental health liaison or designating a member of your team specifically to be a resource to folks who need some individualized help because of anxiety and because of other mental health issues in terms of being able to overcome specific challenges or barriers related to your church. We'll talk a little bit about how you might use your church's communication platforms to make it easier for new visitors with anxiety to feel more comfortable, at their first experience. Talk a little bit about specific inclusion strategies to ministry activities and environments where discipleship takes place. Some of the challenges that you may experience on Sunday mornings when folks are attempting to attend worship services, or challenges involved with participating in small groups, and talk specifically about how you can engage your congregation in the ministry and how they can help in terms of your inclusion process for folks with anxiety. One of the biggest challenges that I can think of for a lot of the families that we deal with in our practice with anxiety is the experience of going to church for the first time. And so a vignette I would just share with your ministry team is if you think about, if you have a family coming for the first time, where you have a parent, say, who has social anxiety, or you have a child with separation anxiety, think about all of the obstacles that they have to overcome the first time they would try to attend a weekend worship service at your church. For that mom or that parent who has social anxiety, how many people are they going to have to talk to the first time they come to church? For folks who may be excessively concerned about how they're perceived by other people, think about how difficult that might be. Again, if you have a child that struggles with being apart from their parent, and part of the culture of your church is that kids go to their worship services and adults go to their worship services, think about how uncomfortable that child might be and how uncomfortable the mom might be if the child begins to become uncomfortable. So if you think through where are all of the possible ways that this could break down, it might help you to understand a little bit better how you go ahead and train your greeters at the front door, how you train your ushers, how you train specific ministry staff who are involved with maybe your children's ministry registration. And we'll talk a little bit more in terms of some specifics later on. But it is really important to think about, how easy would it be, for someone who is excessively self-conscious, or someone who's excessively concerned about the judgments that other people are making of them. How comfortable is it going to be for them to be able to to get through all the welcoming and all the kinds of things that we try to do, to make people accepted, but may rub folks who are anxious the wrong way. Now, Catherine Boyle, pictured here, has a ministry in Virginia, Outside In Ministries, which is also a mental health inclusion ministry. And one of the ideas that Catherine's had that I would very much encourage your team to consider is that she suggests that churches appoint a designated mental health liaison. So that, an example of this when we think about your assimilation process is that, wouldn't it be really great that if you had a family that was where a member of the family or if an individual was wrestling with issues with anxiety, they might have a hard time meeting 10 people the first time they visit the church. But if they could email or text one person after getting their contact information from the website to let them know that they're interested, a way of thinking about a mental health liaison is that they're a concierge in a sense. to help overcome problems. Like back in the day when, I was spending 2 or 3 days a week traveling around the country lecturing with other docs, the most valuable money that I ever spent was on my President's Club membership for Continental Airlines. Because if a flight got canceled or if I ever got stuck someplace, there were a bunch of people in the airport then that I had access to who could help overcome those specific problems. And so that, a mental health liaison might be able to get all of the kids registered for Sunday school or for children's ministry before a family attends for the first time, or would be available to give them a private tour of the church and to get them comfortable with the things that they're going to be doing, the activities that they're going to be involved with, the spaces that they're going to be entering into. A mental health liaison may help to run interference with certain church expectations. Like, I know that when I joined the church that my family I belonged to, we were all expected to join a small group. For someone who's very self-conscious and worried about self-disclosure, that's a challenge. How do you get people to the right small group? And so that those are all specific functions, and there are other different ways that a mental health liaison can be helpful. But again, for someone who's anxious, it's easier to deal with one person who can run interference for them as opposed to having to interfere with or interact with 8 or 10 or 12 different people, especially when you're uncomfortable in new situations. Now, in an earlier video, I think one of the things that we talked about was that sort of the core difference in people with anxiety is that they tend to overestimate the level of risk in new situations and new environments. So that the more that your church can show them what they're going to experience, if they come to, say, like visit a weekend worship service, or if your church is doing an activity that's a little different or outside the routine, the easier it's going to be for visitors to be able to be part of that. And so, like, one of the things that you would want to see if someone was visiting your church website, a big concern for folks who are anxious is they worry about standing out or being noticed for being different. So it's important, can people see, how do people dress at your church? No one wants to feel out of place. So that, like, the more pictures and the more video images you can show folks of what to expect, the more comfortable they're likely to be entering into the environment. Like another example of this, and this is a place where you might have challenges where, you have folks who are wrestling with anxiety who are part of your church. Maybe they come to worship on Sunday, but their kids aren't involved with, say, like, the middle school or the high school retreat, or they're reluctant to get involved with, like, a community outreach or a service activity. Again, the same principle applies. They're fine with the things that they're going to be familiar with. They're uncomfortable with things that are new. So if you're the middle school pastor, the high school pastor, and you want kids to go on the youth retreat, the more pictures you can put on your website of, where do kids eat? Where do they sleep? What do they do? What are some of the activities that are going to take place that they'll be spending their time with? So that, the more by picture or video that you can give people a good idea of what to expect, the easier it's going to be for folks with anxiety to participate in a broader range of activities offered by your church and by your ministry. Now, a couple of specific things I'd like to talk about here would be, one of the challenges that you get into has to do with physical space on Sunday morning. We know that there are, that a fair number of people have, specifically panic attacks or anxiety attacks, or people with agoraphobia oftentimes experience overwhelming anxiety in situations where it's hard for them to leave without drawing attention to themselves. So that a service you might make available on your website, or one of the functions that your mental health liaison might perform, is to work together with your church ushers and make sure you reserve a few seats at the end of an aisle next to a door, somewhere close to an exit to your church, because folks who are prone to panic attacks or anxiety attacks, and we're talking about 7% of the adult population at this point, may have a much easier time being part of a worship service if they know that they can slip out easily without attracting a lot of notice. One of the, I have a friend who's on staff at a very large church that encourages people to be involved with small groups. And they have these giant like meet and greet events for like 2,000 people where they meet leaders and try to connect with a group. Attending an event like that would be sheer torture for somebody with anxiety. So that part of what you might want to do would be to find or identify maybe several small group leaders that you provide additional training in terms of, helping them to encourage and support people with anxiety participating in small groups. Or your mental health liaison would be able to help individual families. If that's something that's important to your church culture and something you want them to do, helping them to be able to identify a group experience that they're going to enjoy and that's going to meet their needs for spiritual growth. A really key place for your people to get involved is that it's going to be the people of your church, your congregation, are going to be the ones who are going to do the inviting. If you don't have a specific mental health liaison, each member of your church can basically be the mental health liaison for a friend or for a neighbor. And that, having someone to go along with you to church for someone who's very anxious, is oftentimes absolutely essential. I'm reminded of a kid that I knew from my community who, this is a striking story, that was very involved with volunteering at her church and spent hundreds of hours literally teaching, Sunday school to preschoolers. And so there was one Sunday where the worship service ran over significantly. And, at this church, they had the high school worship service was in the second hour, and this particular girl taught at the first hour. Well, the first service ran over by a great deal, and she was still there watching kids by the time the second service began. Slipped in quietly to the back of the second service, sat down in the back, and the very well-intentioned youth pastor pointed out to everyone in attendance that this girl was sitting alone. She never again went to church without having a friend to go in with her. And her mom had shared with me that there were times that she would discover her between services sobbing in the hallway while she was texting friends to see specifically if they were going to be present that morning, because she was so uncomfortable. Again, very well-intended pastor singling her out for special attention. So, we have additional resources to help at keyministry.org. I would refer you back to our Mental Health in the Church book. And in our next segment, we're going to be talking a little bit about the challenges that are posed when people have executive functioning difficulties associated with ADHD or struggle with self-control. Thank you.